Alfredo Matute, ventilator associated pneumonia. Ventilator associated pneumonia, Alfredo Matute.
Good evening, Toastmasters members. I'm going to set up the scenario first. You're going to be my value analysis committee. I'm presenting a proposal to decrease the ventilator-associated pneumonia by 10% at your hospital. Pneumonia patients have a mortality rate of about 20 to 33%. Approximately 8 to 28% of those patients develop VAP. Our purpose tonight is to provide you with a plan that is going to decrease the VAP rate at the end of the year by 10%. This is going to be a guarantee program that we're going to monitor for 12 months. We're going to offer the best technology and products in order to accomplish that 10% decrease on infections. And also, we're going to train every single body in the staff members in the different departments that are really are part of the whole program in order to prevent these infections. Those departments going to be the nursing department, the intensive care units people, also the physicians and pulmonologists all together. The program has 4 stages. The first stage will be the kickoff. We come in and we're going to put a custom design plan for the hospital based on all the information that you are going to provide to us. We're going to agree on the timeline. This program is going to last for 12 months, and that's what we're going to monitor every single month. At the same time, we're going to agree on the number of infections that the hospital had the prior year. That is, 2010, let's say the hospital experienced 4 infections. That will be our baseline to work in 2011. If we decrease less than 4 in 2011, our plan is working because we are already decreasing about 33% of those infections. You will ask, what about if we have the same numbers of infections? If you have the same number of infections, we're going to compensate the hospital back for the increase and the products they're going to buy from us. And I'm going to explain that more in detail in the next step. We're going to measure how the infection rate going and how the people are performing their task at the different departments. And how we're going to accomplish that? By training, once again, every single person in those departments. And we will have to make sure that everybody's doing what they're supposed to do in order to keep track of how each plan works in the different departments. Meaning, if the nurses have to do oral care of the patients, they have to follow a protocol. If the respiratory technicians they're helping to diminish that infection, they have to keep checking the pressure in all the endotracheal tubes. Everything has a protocol to follow. We come in and we're going to gather all the information, which is a confidential information that we keep from the hospital, and that's how we're going to be making or fine-tuning this program. What do we require from the hospital? We need you to get our products that we're going to be recommending in order to accomplish this 10% VAT reduction rate. The hospital is already using 2 out of 4 products that we're recommending. So that's going to be a real easy conversion, if you want to call it that way. The products are, the first one will be the trachea products. That's what is called the closed suction catheters that keeps the circle or the circuit closed, and that's going to protect the caregiver. You're using the trachea closed suction, which is good for 24 hours, and we're recommending for you to use the 72 hours. What's the difference? You don't have to change those catheters on the patient too regularly. According to the infection control committee, if you change those catheters every 72 hours, you're going to minimize what is called cross-contamination. And you don't want those bugs to be in the patient. Secondly, we're gonna have the oral care products, which is gonna promote comprehensive routine oral care on the patient, meaning they wanna keep those patients with the oropharyngeal mouth, portion of the mouth clean, because there is a lot of bacteria growing there. The third product, which you already have, is the microcough endotracheal tubes. These tubes is going to prevent any microaspirations, and microaspirations are a big issue because, let's say if you have a trauma patient coming in the hospital and they expirate whatever they have, most of the time that becomes an infection there. These ET tubes are going to prevent those microaspirations. Last but not least, you have what is called the valve cath. This is going to facilitate to take lower samples in the distal part of the lungs, and based on that, they're going to determine what kind of bacteria is there, and they will have a more accurate antibiotic spectrum plan. Like I mentioned before, the plan is going to be for 12 months. By adopting 2 out of the 4 products that we already have, you're going to have an increase in the spend of $80,000. If you go below the 4 cases per year, you're already hitting the minimum expend, which is a VAP is about $40,000 worth. When the patient develops a VAP, it's about $40,000. If you prevent that infection, that $40,000 is going to boost your bottom line. So you will have more money to spend in different equipment and other things that you need. And lastly, if you are above the 10% infection rate, we are going to pay you back, like I said at the beginning, those $80,000 at the end of the 12 months. So it's a risk-free program. The best VAP prevention outcome appear to be a combination of consistent clinical practices, focused education, and superior products. Thank you.